Yeah, thanks very much, Jonathan. Thanks, Julian. Hi, everybody. So, as Jonathan said, I'm Carolyn Wilkins. I'm Chief Executive at Oldham Council, but since April 2018, I've also been the Accountable Officer at NHS Oldham CCG, so have been in charge of a commissioning organisation, and fascinating to see the different worldviews actually from a local authority system and the NHS, where there has been the absolute distinction between providers and commissioners that isn't part of the local government worldview. So just to talk through some of our experience in Oldham and some of the things that we're trying to achieve, which is very much focused on a kind of Team Oldham ethos. And by that we mean that, you know, rather than just focusing on all the resources we might have lost over the last 10 years, actually, can we focus on all those resources that we still have in the borough and interpret that in the broadest possible way? So we're genuinely taking a kind of asset-based approach, but also focusing on getting the most in terms of multiple impacts from all the assets and resources that we've got. So we've been working really hard through numerous routes in terms of building a kind of networked team approach. So we're not focused just on organisational boundaries or institutions, but thinking simultaneously about geographies and systems, so that we are really working in, you know, in that broader way. And it takes ongoing investment and commitment and, you know, support from E3M, from the King's Fund, bringing people in that can help us with this continuous evolution. And part of the challenge really is if we are committed to working in fundamentally different ways to really driving different outcomes for the borough, but we're limited by the existing tools we use. So I think we can see, you know, across the history of public services in recent years, more pilots than the RAF has ever had, but they don't translate into fundamental system change because we still use the same tools then. So actually making that leap between a pilot to mainstream activity needs us to think differently. So for example, a lot of emphasis on recruiting for diversity, changing the kind of the diversity of our teams in organisations, but then we have an induction process that tells people how things are around here. So almost at the very point of access to organisations, you're not working to harness that diversity, you're actually trying to knock it out of people and tell them how things are done around here. So I think there are so many kind of core processes and procedures that we just need to step back from and fundamentally deconstruct to see if they can be redeveloped in ways that actually enable us to drive the change we want to see, rather than that change happening in spite of the processes and procedures that we've got in place. And procurement is a really good example of that. I think, you know, social value has been an add-on rather than a fundamental reform of the way that we procure or commission approaches. So part of what we're trying to do as the sort of strengths-based, asset-based working is clearly do that shift from very acute reactive ways of working to much more of the early intervention, the kind of the prevention agenda. And our social prescribing programme is a key part of that. And what we decided to do was use the innovation partnership approach to secure the kind of the delivery infrastructure for our social prescribing work. So in itself, it's a programme about doing things differently, about not having a medical model to wellbeing, but actually, you know, the broader kind of social approach to wellbeing and health, and getting in much earlier and upstream. So we've developed pathways of self-referral. We've got link workers that use a person-centred approach, so that we're very focused on what people can do and using that as the starting point for change. And the approach enabled us, the innovation partnership approach enabled us then to commission a local consortium of voluntary community organisations for a contract in excess of £1 million. And there are a range of reasons why that was so, has been so important. I mean, it was important before COVID, but it's been an absolute godsend during COVID. Partly because of the Agile Startup approach. So rather than the traditional kind of commissioning approach, where you get a team of expert commissioners who sit in a room, you know, and I'm stereotyping to make a point, but sit in a room and kind of draw up a spec of what wants to be, it goes out to market, it gets awarded, and then it's fixed for, even with some flexibility built in, it's relatively fixed. The Agile Startup approach is much more about an iterative approach. So you're building in kind of beta testing, beta development right from the very beginning. So you're not starting saying that you've got all the answers and that you're looking for a partner to help you deliver them. You're starting from a point saying, actually, we think we know what the questions are, and we think we know what some of the areas we want to look at, and we'd like to work with you to further iterate those and the ongoing development. And it has enabled us, I think, to build feedback loops in and rapid change cycles in a way that actually we've really struggled to with more traditional kind of ways of working. And, you know, so, and if we needed to do that before COVID, you can just see how the agility that we needed to have, and actually it's given people the confidence to work in that way. And the multi-stage approach to the innovation partnership also drives consortium building, because you're constantly thinking about, have we had the right conversations, have we got the right people in the system? So it builds in that iterative approach right from the beginning, and also, you know, demonstrating impact as you're going through those cycles. So you've got the ability to kind of rapidly reset and adjust. So we've got the Action Together partners, Age UK, Positive Steps, Mind, all coming together in this coalition, with Action Together being the kind of the lead partner. So we're investing in the infrastructure of the borough, because part of the Team Oldham approach is recognising that, you know, social infrastructure is as important to the borough as physical infrastructure, and neither of those things grow and are sustainable without ongoing investment. But I think we've had a bias towards investment in physical infrastructure in recent years, particularly with our kind of economic a strategic approach as a country. I think COVID has absolutely shown us that the absence of social infrastructure is a significant risk to the well-being of communities, but actually to the security of the, you know, of the nation, actually. So our networks in operation now across the whole of Oldham, bridging the gap between medical care and the community, link workers in each of our 5 primary care networks, and forming a whole range of different services. So we've got over 700 connections now into more than 80 voluntary and community groups. And we've got the Elemental system, which is now a live connecting system into the primary care EMIS system. So there's direct referrals into communities from kind of GPs, which are really, you know, significant developments. And I think some of the big challenges now that are facing us, what's been absolutely stark throughout COVID has been, you know, the cost of inequalities. So the deep systemic inequalities that exist, and the real challenge for formal traditional organisations and institutions being able to work in agile enough ways and connect more deeply enough. I think we have to fundamentally review the tools and techniques that we approach to the development of public services, the way that they're commissioned, the way that they're monitored, the data and insight that we use to start with, in terms of, you know, much deeper understandings of our communities, of their lived experience and the way that they live. All sorts of assumptions, I think, have been made about that. And if you start with a strategy and you don't really ask who does this strategy not work for as much as who does it work for, then again you're setting yourself up to have an approach that misses significant sections of your community. And again, with the innovation partnership, those gaps in knowledge aren't necessarily the flaws that they would be in a much more rigid procurement or commissioning framework, because you've got space and time to kind of grow and spread out into, you know, and address some of those gaps. So I think in terms of barriers to this way of working, which is just one of the things that I was asked to touch on, I think newness can be a barrier, and there's a barrier to doing things at scale. So, you know, people's appetite for risk can be a limiting factor in this. I think the fact that this is the tool that's already formally approved by government, you know, it's on there as an approved approach, de-risks some of that. I think there is still nervousness about new. So the support actually of E3M was really fundamental for us, because we had a number of sessions with key kind of players across the borough have the conversations and about opening people's minds up to difference and what it could achieve, and that kind of ongoing development conversation. So we weren't landing this in a completely kind of cold environment. We've done an awful lot of that sort of engagement and warming up, which has made it much easier to get that kind of that approval, and I think that ongoing investment actually in the kind of leadership capacity and support is really crucial, actually, as we're really trying to fundamentally change the way that we work. So they were the key points that I wanted to make, Jonathan. So I'll stop there and hand back to you.